I think the reputation of Newcross is on two parts really. I think the candidates know they're going to be looked after. We do make sure they have the training updates. You know, we don't let that pass after 13 months. That has to be done. Also, the type of diversity in the clients that they get, a lot of people do like and do take that on board when interviewing and registering with Newcross. We get to supply our staff into hospitals, prisons, care homes, into clients' homes. So I think that reputation as well sets us aside from our other competitors.
Well, I was attracted to Newcross because it gave me flexibility of hours, and I've got a young child, so I could work within school time and day shift more, and excluding nights, which I do, which is ideal for me.
A friend who used to work for Newcross, so when I started looking for a job, she kind of said, "Oh, why don't you go and have a go and see?" And I did.
Newcross employees do have their own contracts, and this is why they are not agency workers, and Newcross does not class itself as an agency.
And you are protected legally, and you have indemnity and insurance.
Because you're not an agency worker, you're employed, all your tax, insurance and wages and everything, your insurance, you know, public liability insurance, that's all sorted out, taking out your wages, it's all done and dusted when you get it.
I work with Newcross 3 to 4 days a week, and it gives me time with my family and time to do my voluntary work, and you know, to have a general equilibrium in my life.
With some agencies, they don't get travel time or petrol allowance. We get paid a certain amount of travel time in between jobs. And as you can imagine, we have to spend quite a lot of money on petrol, so you know, that's a big plus.
Newcross Healthcare workers can be going into a range of settings, whether they're a nurse or a healthcare assistant. We provide into hospitals, prisons, children homes, elderly residential and nursing, and also out into the community.
Yeah, you have to be able to use your initiative a little bit, because you never know what you're going to find when you get to a client's house. Every client's different, every day's different.
They two come in the morning to get me up. Then one comes back at lunchtime to do my lunch. Then I have another one at tea time. And then 2 come to put me to bed. Then nothing's too much trouble for them. Yeah, they're beautiful girls, all of them. I'm very pleased I've got them.
We regularly train our staff monthly, yearly, and make sure they're up to date and in compliance with the CQC. The training that they get on offer is mandatory, and we also offer on the side things to go in line with where they work. So if they're doing hospital work, we'll make sure they've got observation training. If they're going out into the community, we'll make sure they've done shadow shifts. With the training, we allow our staff, every hour they earn, they will accumulate 5 training credits an hour. That will build up in a side pot that they can view and we can view, and they can use to pay for courses with those training credits.
I've had so much training, it's amazing, because there's so many different, it's from learning disabilities to epilepsy to medication management. Whatever you like to do, you can join Newcross, and then you can find out, you know, exactly where you want, what you want to study.
Before you even go out to visit a client, you have to do an in-office induction, you know, health and safety and all that type of thing. Then you start shadowing, that's part of your induction. You go out with some of the other girls and you literally watch what they do to start with until they feel that you're capable of actually doing the work. Then you go out with another girl. You don't go out on your own for quite a while till they think that you're able to.
We make the investment in training for our staff firstly as a personal development plan, which we make sure we keep up to date with them on a 6-monthly and 12-monthly basis when we do their appraisals. The training is also used to give ourselves a competitive edge and step away from some of our competitors, and we then implement that into the individual care environments we provide into.
The computer system, it's really useful because I can go online and see what hours I'm doing, say, next week. I can print it off if I want to. I can also do my availability. I can get my pay slips online. I can see how many hours I've worked, how many training credits I've got.
The system allows them to see everything from timesheets, pay slips, all the things that they actually are very interested in, and also lets them put on their own availability. It's quite a manageable system in the sense that they can take their availability off and put it on, and also self-manage themselves so they can see if a client is looking for a staff on certain dates and times of the week, and they could actually ring us up and ask for those bookings rather than waiting for a call. So if you are, you have family commitments, you have other commitments, it really lets you be flexible, dictate when you want to work, and self-manage really. You can input the times and dates and be as specific as you want to just mornings, afternoons and evenings. So if you do have a future holiday coming up or something you really want to save for, it does allow you to really put as much availability in and maximise the amount of hours you're going to get. And that's a really great benefit of working for Newcross.
I do everything online, so I find it quite easy to use. But yeah, it's much better than having to keep going into the office and phoning the girls every 5 minutes.
We do appraise them, so we get the feedback from the clients, and some of the feedback is really brilliant as well, and some go out really chuffed. But we've also got in place a quarterly Excellence in Healthcare award, where we actually get people to recommend the healthcare worker that they've either had working for them or even just worked with out in the community.
We have to fill in questionnaires on all the girls. And Donna Rose, well, they're all beautiful, but she won the big award.
And then at the end of the year, all the people that have won the quarterly awards will be then drawn for the overall Excellence in Healthcare for that year. The winner of the Excellence Award does actually get a financial award that is presented by the Managing Director of Newcross, along with an actual trophy and a bouquet of flowers.
And we need to communicate and we need to give something back. It's part of the process of, we're all growing older, we're going to need the care someday, and I hope that people out there will realise that it's a two-way street, we help each other.
Newcross Healthcare really does have a really good reputation. That's based on a number of things, but really the way we personally develop our candidates and make sure they are fit for the workplace they're going out to, the training that we offer, all the flexibility and diversity and everything that they can do, also then reflects on happy clients.
And they're a lovely team of girls. I can't praise them more.
Erskine's used Newcross for about 5 years that I've been here, and possibly longer than that. We've always had a really good relationship with them. They send us a very high calibre of staff, and the staff are reliable and on time and follow procedures.
The interview process was very easy. I found out and had an interview next couple of days. It was quite easy and coming in and a very friendly environment. Joining Newcross, I hope to gain more insight into the care industry and further my career in the care industry. I hope to gain manual handling experience, first aid experience, and maybe kind of autism and learning disabilities awareness and things like that.
Our staffing is always a challenge because we have to cover the needs of the service, and this means that our staff need to have their holidays and there's often sickness. We use both healthcare assistants and registered nurses here in the home from Newcross, and it's very often on night duty that we might have somebody go sick at short notice, and we're very fortunate that Newcross are always able to help us and send really good staff to help us on those occasions. I know that they have a very high standard. The staff are expected to be very professional, highly qualified, and many of the nurses that I worked with were people like myself who've been in nursing many years, have been ward managers, have a great deal of experience, so I knew that Newcross was the agency that was best suited to meet my needs.
Newcross Healthcare really does have a really good reputation. That's based on a number of things, but really the way we personally develop our candidates and make sure they are fit for the workplace they're going out to, the training that we offer, all the flexibility and diversity and everything that they can do, also then reflects on happy clients. Newcross Healthcare is a really great team to be a part of.